Today, we're going to dive into some really fascinating new research in the world of bladder cancer. We're going to look at some studies that are uncovering some really interesting ways to support patients. These are discoveries that honestly bring a real sense of hope and the chance to be more proactive in your own health journey. And that really is the big question, isn't it? Researchers are starting to look beyond the usual treatments to find allies in some pretty unexpected places. So, let's see what they found.
So what we're really talking about here is teamwork. This isn't about replacing standard oncology care, not at all. It's about finding ways to support it, especially for patients who are going through immunotherapy. The goal is to potentially improve the results and give them, as one source put it, many more good days.
So our first discovery, man, it's a perfect example of this. We are talking about something that many of us probably have in our medicine cabinets right now, antihistamines. I know, it sounds a little out there, but the data is surprisingly compelling.
So where does this idea even come from? Well, it's from a pretty big, randomized clinical trial. We're talking about almost 900 patients, all of them receiving immunotherapy. And it turns out about 17% of this group were also taking antihistamines for, allergies or other reasons. And researchers, they noticed something.
41%. Just let that number sink in for a second. That's the number that really made researchers sit up and pay attention. Let's break down what that actually meant for these patients.
Okay, get this. For the group taking antihistamines, what they found was a 41% higher relative overall survival rate. And on top of that, their progression-free survival, which is just the amount of time they lived without the cancer getting any worse, was, on average, 30% longer. That's a powerful connection that definitely needs more research.
All right, moving on to discovery number 2. This one looks at a really fundamental part of our health, iron. Turns out how the body manages its iron supply could be an absolutely crucial piece of the puzzle.
The research on this is just crystal clear. There is a huge difference in outcomes. Patients who have good hemoglobin levels do so much better than patients who are dealing with anemia. In fact, one study found a 57% risk reduction for people with healthy iron levels. And since anemia is a really common problem for bladder cancer patients, this is a big deal.
So, you might be asking, how do you even begin to manage that? Well, one potential tool researchers are really excited about is lactoferrin. You can think of it like a master regulator for iron in your body. It's a protein found in milk that helps the body absorb iron and get it where it needs to go. And at the same time, it helps cool down that iron-related inflammation.
So here's the crucial part, how it's thought to work. First, it helps improve that essential iron balance. That, in turn, helps boost your red blood cell counts to fight off anemia. And, this is key, it helps lower levels of something called ferritin, which is a marker for the kind of inflammation you really don't want. Okay, and that brings us to number 3, our final big discovery. And this is another one you've definitely heard of, but it has a potentially huge impact. Vitamin D3, the sunshine vitamin.
And look, this isn't just a hunch. It's coming directly from the research. Check out this quote. It says that having good vitamin D levels before you even start chemotherapy was directly linked to better overall survival rates.
And when you look at the numbers, they're just staggering. One analysis of over 100 patients found that those with higher vitamin D3 levels, even at a pretty modest level, had more than a 2.5 times better relative survival rate. That is a massive, massive difference.
But wait, there's more. Seriously, those 3 are the big ones, but the research points to a few other really promising areas too. We don't have time to go super deep on all of them, so we're going to do a quick-fire lightning round to see what else is on the radar.
Okay, we're going to touch on 3 more. Low-dose aspirin, an herbal extract called danshen, and that powerful anti-inflammatory compound, curcumin. All right, let's hit the data fast. First, aspirin. Studies suggest that a regular low-dose aspirin is linked to about a 30% lower risk of the cancer progressing. Next, danshen. A huge analysis found a 40% lower risk of dying from any cause. And finally, curcumin's anti-inflammatory powers have been linked to potentially cutting the mortality risk in half for some patients. Now, remember, these are associations, right? Not cause and effect. But wow, what an exciting area for more research. Okay, so we've just thrown a ton of information at you. Let's take a breath. What's the bottom line here? What does all this actually mean for you or for someone you care about?
Look, the whole point of this, the reason we're talking about it is to empower you. It's not about running out and buying these things. It's about arming you with information so you can have a really smart, proactive, and collaborative conversation with your healthcare team. It's about asking better questions.
And I have to be absolutely 100% clear on this. This is not medical advice. Please, please always talk to your doctor or oncologist before you make any changes at all. Think of this as background reading for your next appointment, a way to start a really important conversation.
So we want to leave you with this question to think about. After everything you've just heard, which of these discoveries surprised you the most? Which one will you bring up with your healthcare team first? That's the first step. Thanks so much for joining us.